Sepsis is something you may not have heard of before, but it is considered a medical emergency now. And Dr. Nicole Haig-Jasper from Coliseum Medical Centers is here to talk all about it. And I tell you what, Doctor, sepsis, not something that you're like, oh my gosh, you have sepsis, or don't get sepsis. It's, it's not one of those things that people talk about, but it is a very serious thing. So thanks for being here.
No problem. Thank you for having me. The thing about sepsis is it is a medical emergency. It's a complication to your body's response to overwhelming infection. And this can lead to tissue damage, organ failure, or even death. And the problem with sepsis is a lot of times we don't recognize it early enough because it mimics other things. Or two, by the time someone comes in, they're so ill that we are then trying to catch up and treat them appropriately. We know that the majority of infections come from 4 organ systems. 1, lungs. So people who have COPD, emphysema, pneumonia, people who have skin infections such as cellulitis, decubitus ulcers or MRSA, like gut infections such as diverticulitis or colitis, and urinary type infections such as urinary tract infections or kidney infections.
Gotcha. So this could be something that is kind of, for lack of a better term, it kind of puts the cherry on top. I guess the cherry is a good thing, but it adds on to something that's already bad that sometimes can be misidentified.
Exactly. And there's certain signs and symptoms that you need to look for. So if you're having, fevers, chill, extreme cold, increasing pain, shortness of breath, clammy skin, increasing fever, or altered mental status, those are reasons to go and get a higher level of care. May it be from your private physician or the emergency department. That's why we're here.
Yeah, well, that makes a lot of sense. And I imagine, if you have some of those things, it's already bad enough. You go into the doctor, and it might be smart to go ahead and say, hey, doc, just make sure you're looking for sepsis as well, because I don't want this to kind of evolve into something that's bad. So if you just say the word sepsis, hopefully the doctor will be able to say, oh yeah, let me check for that real quick.
Right, and it is a hot topic for us right now because we know that the earlier that we treat and diagnose and identify sepsis is the better that these patients are going to do long term. So for all of us as clinicians, we are being re-educated on how to look for sepsis, treat it faster, treat it more efficiently, knowing that patients will do better. But patients also have a part in this. So what can you do to prevent sepsis?
That was my next question, yeah.
1, just basic things. If you know you have a chronic disease such as COPD or diabetes or kidney disease, you need to make sure that you are really vigilant in taking care of yourself and having control over that disease process. Take your medications, wash hands, take your vaccinations like they're recommended by the physicians. And 2, if you find that you're not doing well, be early in your treatment plan, meaning don't wait and say, oh, I'm going to wait another 2 days and see how I feel. Get to your doctor right away. And for those of us who don't have chronic illnesses, we need to make sure that we're being vigilant in preventing illness also. Hand washing, #1 and easiest way to prevent infection.
Easily. Well, doctor, thank you so much for being here today. Talk a little bit about something that, once again, not a lot of people know about, so thanks so much.
You're welcome.
Awesome. We're going to have more information about sepsis and about everything else you need to know on our website, 41NBC.com. Here in the next